video is about the coronavirus, COVID-19, and how it has affected my cancer not my cancer diagnosis, but just like my cancer treatment and this process, as well as how it's affected my pregnancy. And this is not a political video by any means. This is, COVID is a real thing, and it has impacted a lot of people in many ways. And there are many, many restrictions in place and laws and emergency orders and guidelines and everything like that. And it has definitely had an impact on 2020 as well as 2021, and this whole cancer journey. For some reason I don't like the word journey, but as well as my pregnancy, as I said. And so just kind of share a little bit of how it has impacted both of those things. So again, I'm not getting at all political. I'm just, gonna share some facts with you and my personal experience. And then as well as at the end, I plan on sharing some positives. There has been some positives that have come from the coronavirus, and I want to share those as well. So to start at the beginning, and I have shared in my cancer diagnosis videos a little bit of this, but I'm going to share it again. But when I first noticed symptoms back in last spring, late spring, early summer 2020, I had an appointment with my gynecologist, and that appointment had been postponed 3 months total. I think actually I tried to get in the end of January. I called the end of January. They scheduled me for February. That was before anything happened. End of February came, and I got a call saying, let's move it to March. March came, I got a call saying, let's move it to May. May came, and that's when I had kind of started noticing some changes. And my appointment, actually, I think at that point was going to be in June. And again, I think I called in January to set up this appointment. And I didn't call the first time to set it up because I was noticing symptoms. But it is a routine thing that is done at that appointment, at least at my appointments, is getting a breast exam done by a doctor. And so, it just makes me wonder, what if I did get in February? What if I went in that first appointment? Would my doctor have been able to feel something or see something that I didn't notice until too late? And not too late, but, just later. And so the reason that all those appointments were postponed and changed was because my doctor's office was not seeing patients for routine visits. They were just seeing patients for, I know they were still seeing pregnant patients, and they were seeing patients with problems, and I wasn't considered I had a problem at that point until May, when I called and, told them about the masses that I was feeling and the symptoms I was having. And so, just that fact alone, the fact that doctors' offices, weren't seeing patients routinely is kind of scary, because a lot of things can be found routinely, and it's just kind of saddening. But it's a fact. That's what happened. The second thing was that when I was referred to get my very first, this is last summer, mammogram and ultrasound, I called my normal hospital, St. Joe's, and they would not see me. I think I shared this before. I don't know if I didn't communicate very well on the phone, but I called the breast clinic, and I told them I had a referral, and I'd like from my doctor to be seen, and for some pain and some masses I was feeling, and I wanted to set up an appointment. And I was told that they weren't currently seeing anyone, but in next month they would. So they scheduled me out for a month out. I did set up that appointment. I didn't end up going because I got into U of M earlier than that. But that was impactful, you know, like it's just kind of surreal that a hospital wouldn't see a patient with a problem because of this worldwide pandemic. It's just, you know, it's just like something you would never think you would see in your lifetime or never see happen here in America. When I was finally able to get into the University of Michigan, I was not able to bring Paul with me to those appointments. And I mean, I'm a grown woman, I can handle it, but you know, for something like this, you do want him here. I did want him there, and especially with the pregnancy, like later on down the road, I had him at all of my pregnancy appointments with my first doctor, and it's just something that I wanted to like share with him. And so that was hard. And it was also hard, like he wasn't even at my first appointments, he wasn't even allowed in the building at all or in the weight room, like even like outside of like the breast clinic at U of M. And he had to wait in the car. And so he was in the parking garage that first appointment for 4 hours. And then, which was unexpected, we thought it would just be 1 hour. And you know, at that first appointment, it was like a little bit nerve-wracking, little scary, you know, like the more and more tests that they were ordering. And then, you know, culminating at the very end when they told me that it was very likely that I had cancer. And that, of course, also was all done with mask on. I had a mask on. All the doctors and nurses had masks on. And it's just kind of, you know, I think facial expressions are really important, and they convey a lot of feelings. And you know, there's only so much you can like see with like your eyes. And it was just different. It was just, you know, not how you would expect to be told that you probably had cancer alone and with everyone wearing masks in the middle of a pandemic. I didn't know I was pregnant then, but so going forward to my surgery, the COVID guidelines had an impact on that. Paul wasn't able to, things had kind of loosened up a little by then. That was, you know, in June, but because it was a surgery, he was able to go with me, but he wasn't able to like be with me overnight or stay in the surgical short stay afterwards. So also after my surgery, I did have some lymph nodes removed, and because of that, there is like a little bit it does to your immune system, just having a big surgery like that, being pregnant, and then having lymph nodes removed. There's like some cause for concern for like how it's easier to get certain infections. And so we did make the choice to kind of like really limit our exposure out in public. After my surgery, we did like grocery pickup or drop-offs, and I didn't attend church during that time, and we like limited visitors that we had over a little bit. So, you know, we probably would have done some of that anyways, but there was just like this, I feel like there's this like umbrella of, I don't know, caution over everything, every decision that you make, every decision that, at least a lot of decisions we've made in the last year because of COVID-19. And this is a constant conversation that Paul and I are having, an ongoing discussion, and something that we talk about often. You know, we have to like balance our trust in God, that God's gonna protect us and keep us safe, but then also like we have to be cautious. And I just want to trust God that God will protect me, but like that's not a promise. God doesn't promise that he's going to protect me from coronavirus. And so I can't, you know, I could pray and ask for protection, but it's not a prayer that is like guaranteed to be answered. There are so many people, I think, that didn't think that they would get sick, and they did end up getting sick. And I mean, I'm a person who never thought I would have cancer, and God, you know, decided that's what was best in my life right now. So looking at the pregnancy side of things, that was a little bit more impactful, I would say, almost. At the beginning, Paul was able to go with me to all of my appointments, and but then towards the end, like it was like kind of a shock. It was like in the fall, they just like turned him away at the hospital and said that he wasn't able to come. And we like hadn't been staying up to date on the visitor guidelines because kind of thought everything will be okay. And so towards the end, he wasn't able to go to like my appointments. My appointments were like every other week by then. And so there were a couple like ultrasounds that he missed out on. And that was, you know, we did have, you know, he had been through everything with Charlotte, every single appointment. And I know it's something that was really important to him and it was hard, you know, but yeah, it just, I'm trying to stay away from like being too like negative on COVID and the guidelines and everything, but like I'm not happy about them, you know. It's like it just isn't fun. It stinks. For my delivery, actually U of M at that point were allowing 2 visitors or 2 like support persons for every mother delivering. When I had Charlotte, I only had Paul with me, and so that was the plan. When I had Abigail, I only had Paul with me, but they were allowing like a second visitor. We just opted not to have a second visitor at all. But you know, afterwards with Charlotte, my first, I was able to like invite my parents and Paul's parents and like some like close friends to like come by at the hospital and like pop in and visit and see me and the baby and Paul. And so we're not able to do that at all with Abigail. So, you know, everyone just had to come visit later on, which we also like tried to limit who we had visiting. The first time that Paul saw Abigail, or that Abigail, you know, saw Paul, he was wearing a mask. Now, I didn't have to wear a mask at the hospital after I got a COVID test. So when I got to the hospital for my induction, I got a COVID test, like one of the first things, and it was a rapid test. And then with it, just like a couple hours, they got the results. It was negative. And so I was able to like have my mask removed. But Paul had to wear his like the whole time, unless like nobody was in the room except for him and I. But of course, when the baby came and there were like doctors and nurses there, Paul had his mask on. And so it's just kind of like all the pictures, like he has a mask on, and like the first time he saw Abigail and she like looked at him and everything, he had a mask on. And I don't know, it's just different. We were really cautious like the last month, maybe 6 weeks, about the last month before we had Abigail, because, you know, if I got COVID, obviously they're gonna still let me have the baby and like still help. You know, I don't have to do it on my own or anything. I would just have to like wear a mask, and I'm sure they would like take extra precautions. But if Paul got COVID before Abigail was born, within like 21 days or something, then he wasn't gonna be able to come to the hospital with me at all. And so, you know, it was really important that I had him there. And so we again, it was like that struggle. Like we wanted to trust that God was going to protect us, and he did protect us, but we also made sure that we were smart and took some steps to like limit our exposure. And the biggest thing, because like was attending church. And that is something that is just so like hard. It's like a really, really, for me and for Paul, it's a really difficult decision, especially right now that I'm in like doing these chemotherapy treatments. I want to be at church so bad. I feel like this last year, like all of 2020, almost of it, you know, like at the beginning, you know, we canceled services, we couldn't go, we had home church, that was like kind of fun for a little bit. And then like it was like 2 weeks back when we started services back up that I got my cancer diagnosis, and then found out I was pregnant, and then like immediately had a surgery, and then was out for like 6 or 8 weeks, and then started like getting back integrated a little bit into like services, and then pregnancy hit, and we had to like be cautious, and then we did have like one close encounter at church and had to go get tested. And but so anyways, I just feel like I've been like kept up all last year. I mean, it was a good year despite a lot of things, but it was just a different year, and a year where, you know, I just like didn't have like the same ministry opportunities at church, and I wasn't able, I don't know, just to be there in person. And it's really important to me, and I love my church family, and I love like fellowshipping, and I love just being in the building and like singing as a congregation. And so like right now it's just really hard to like I feel like I'm just like stuck at home, and I like the biggest thing that I want to go do is to be at church. And I know that it's just a phase, and I know that it's temporary, but I don't know, it would make me feel better and it would make me feel like a sense of normalcy, and in like such a uncertain time in my life. Like church is always the same, and the people there are loving, and the people there are supportive, and people are reaching out. Like my church family has been so supportive during this time, and like messaging me and sending cards and messages and gifts, and like they're just like so loving. But there's nothing just like the sweet fellowship of other Christians like face to face. And so oh my goodness, I'm like really crying. I just like really miss that. And Paul wants to like give that to me really bad, but he like, especially like being the protector and like the man of our house, he's like making decisions, and like I'm like listening to him, but he's just like trying to keep me safe. And I understand that, because like anytime he like brings up, or anytime I bring up something and then like he brings up like I just agree with him. He's not saying anything that's unreasonable. I agree with everything he's saying. I'm just like sometimes let my emotions get in the way. Okay. It's just a constant like struggle. Again, I've said this like 3 times now, of balancing trusting in God but being safe and cautious. And it's just like a gray line that I just have a really hard time like going back and forth on. Like I'll feel guilty for, I don't, like back a couple weeks ago, like running into Target, you know, like if I could run into Target and like pick up diapers and wipes, can I go to church? But you know, when I go to Target, I'm not like hugging people and visiting people that I love and I miss. I'm just like walking in the store and like doing my thing and like walking out. Anyways, okay. And then obviously COVID has had a big impact on my chemo treatments, like having like someone with me. And I've only had 1 treatment so far. Well, my first infusion. My next one is a week from today. And it was okay. Like I was so thankful. Paul, U of M has opened up some guidelines, so he was able to go with me to my like my blood draw, kind of like he was at the waiting room. I went back, and then he was able to go with me to visit like with my oncologist and the nurse. And then we like I shared in one of my videos, we like ate a quick bagel and nasty coffee, and then waited in the waiting room. But he was not able to go with me like actually into the infusion room. And it would be really nice. It was like, you know, 3.5, 4 hours of sitting in a chair hooked up, and it would have been really nice to have him there with me, and him there with me going forward. And I asked the nurse if she thought maybe, you know, with things how trending, if she thought that they would loosen that guideline, and she kind of said that she didn't think so. She's like, you'll be done in June? I said, yeah. And she said, yeah, I don't think that they'll change anything by then. And I get it. Chemotherapy does weaken your immune system, or it has that potential to do that. And I keep telling myself like, well, I just got my blood taken and my white blood cells are still in the normal level, so does that mean I'm good? And I also keep thinking that patch that I get after every infusion is something that helps with that aspect, with keeping like your white blood cells numbers up, so that your immune system isn't just like brought down. And I asked my oncologist if there was like a magic number with your white blood cells that makes it like more risky to do things, and she's kind of like, no, there's no number. Yeah, so COVID just has like it's just like this weird cloud over everything in my mind of decisions that we make this year. This year I kind of like, I want to go to church. I want Charlotte to go to Sunday school. I was just thinking about how like she is at the age and like ability to like communicate more now, and she would just love Sunday school and the stories, and I'm trying to give her some of that here, but it's just, you know, it just would be wonderful if she could go to Sunday school. And I want to like go shopping. I love shopping. That's like my thing I like to do. And like I like to go like all the different stores and thrift stores and find like great deals. And I want to travel. And I want to like see family and friends without like being worried like, oh, were you sick recently? And yeah, so it's just a little, it just has had an impact on this last year. And I wonder if COVID wasn't a thing and if no one was worried about it, you know, if like I would be like have an easier time right now. We would still have to make some decisions and be cautious in some areas, but I don't think there would be like the cloud of COVID over everything. Now, like COVID has had like the con list. I also wrote down a pro list. There are some positives to all these guidelines and things, and the biggest one is that Paul works from home now. And that has been so amazing. He was driving like an hour or more some days with traffic and everything, like one way to get to Southfield and work. And then, you know, would work all day and then like come home. And then like that just immediately stopped in March. And so like this year he's been home a lot more, and like he saves like, you know, like almost 2 hours a day on like that commute. And he's able to like spend it home with us and Charlotte and be like so helpful. Even before I got sick, just like amazingly helpful. And then like after the surgery, you know, he could like come up here and help her get Charlotte down for a nap, because I like wasn't able to like pick her up and things. And so it's just so wonderful having him here and having that flexibility in his schedule. We even built a room in the basement, finished a room down there so that he would have like an office, because we gave the room he was in to Abigail for her new room. And so, you know, I don't know if I would trade like how COVID has impacted me for that ability for Paul to work from home, or I don't know if I would trade that or not, but it has just been wonderful, and something that, you know, moving forward, Paul's like pretty confident that, you know, he wants to always work from home. And you know, they're pretty confident too that in his work, I believe that he's gonna have that ability. And so that really has been the biggest blessing and just the biggest gift. Another thing is, because of COVID, I did end up at the University of Michigan because St. Joe's wouldn't see me. And so I do think that that is a good thing. St. Joe's is a wonderful hospital, but I just feel like the care I've received at the University of Michigan has just been amazing. And, you know, I'm just very, very, very thankful for that. And then also just because it just is a little more convenient, but a lot of doctors' offices are switching to doing a lot of video visits if it's not like if an exam isn't needed. And so I have been able to have like the convenience of staying at home in front of my phone, usually is what I use for these video visits, and that has been convenient. You know, instead of like doing like extra trips and commuting to the hospital or to different doctor's offices. That is how the coronavirus in 2020 and then now moving into 2021, all the guidelines and regulations have kind of affected my cancer treatment and my pregnancy.